Okay, so picture this. You need to see a specialist for something um, pretty complex, maybe even could be life-threatening, right? But there just aren't enough specialists to go around.
Yeah, unfortunately, it's a reality for a lot of people these days.
It is.
The World Health Organization, they're predicting this massive shortage of healthcare workers. Like by 2030, we could be short 18 million providers.
18 million, wow.
Yeah, it's a huge number. And as you can imagine, the impact is widespread, but it's especially concerning in areas like cardiology, where, you need that quick and accurate diagnosis.
Makes sense, yeah.
It can be really critical.
And this actually reminds me of some research we were looking at about hypertrophic cardiomyopathy, HCM.
Right.
And this is a leading cause of sudden cardiac death. And more than half the states in the U.S., they don't have a dedicated center to treat it.
It's a big problem. A lot of people are going undiagnosed, unaware of the risks.
So how do we bridge this gap then?
Well, that's where things get really interesting.
Okay.
This is where AI comes in, potentially.
Okay, so we're not talking about robots operating on people.
Not yet, not yet.
Okay.
But there's this system that's being tested at Stanford called AMI, which stands for Articulate Medical Intelligence Explorer. But really, just think of it as a really, really smart medical student that's constantly learning, analyzing tons of data.
Like a superpowered assistant for doctors,
Mm-hmm.
helping them make sense of all this complicated information.
Exactly. And the researchers at Stanford wanted to know, okay, how would Amy perform in the real world? So they used data from 204 real patients
Wow.
at their Inherited Cardiovascular Disease Center.
Wow, so using real data, real patients.
Absolutely. They had AMI and an actual cardiologist review these cases. And then to really put them to the test, they had specialist cardiologists, the top of their field, finally grade their work.
Okay.
So it was high stakes.
High stakes, yeah. And they had all sorts of data to work with, right? Like EKGs and echocardiograms, all that.
Oh, yeah. They used a whole range of data, ECGs, echocardiograms. They even threw in genetic testing, which is really complex information.
Oh, wow.
The kind that normally takes years of specialized training to really interpret.
So how'd it go? Did Amy pass?
Well, Amy did surprisingly well. I mean, in a lot of areas, it was judged as good as or even better than the cardiologists.
Wow, that's incredible. What were Amy's, biggest strengths? What was it best at?
So one of the things that really stood out was just how thorough Amy was.
Okay.
It was really good at considering a wider range of diagnoses than the human doctors.
Oh, interesting. So it was like having an extra set of eyes, making sure nothing was missed?
Yeah, exactly.
Right.
It was really good at picking up on those subtle clues in the data, things that maybe even an experienced doctor might overlook.
It's almost like because it's AI, it doesn't come with those inherent biases that we humans develop,
Yeah, that's a really interesting point, and it might play a role.
Yeah.
But there's another area where Amy really, really excelled.
Okay, what is it?
Genetics.
Ah.
When it came to incorporating those genetic test results, AMI was spot on.
Wow, so it could connect those dots, like those complex genetic factors with someone's specific condition.
Exactly. It's all about seeing that bigger picture,
That's fascinating.
which Amy seems to be really good at.
But I'm guessing there's got to be more to this story, right? It can't all be perfect.
You're right. You're right. Amy's not about to replace doctors tomorrow.
Right.
There are some caveats.
Okay, let's dive into those. What were some of the limitations?
Well, while Amy showed a lot of potential, it did tend to make more errors
Okay.
that in a real-world scenario could have led to, unnecessary tests or interventions.
Oh, so it was a little overzealous sometimes.
Yeah, like that enthusiastic student who's, a little too eager to impress.
Eager to prove themselves,
Yeah, exactly.
but with room to grow.
Exactly.
So before we get too far, I'm really curious about something. What happened when these cardiologists got to see what AME came up with and could revise their initial thoughts?
Oh, that's really interesting. Their accuracy, it actually improves significantly.
Really?
Yeah. In over 60% of the cases, seeing Amy's perspective actually led to changes in their diagnosis.
Wow, that's incredible. So it's like having that super smart assistant that we were saying, double-checking your work, maybe catching something you missed.
Yeah, offering a fresh perspective that maybe they didn't see initially.
Wow, so it's not about replacing doctors. It's about making them even better at what they do.
Precisely. That's what makes this research so compelling.
Yeah.
It suggests that AI could really help us provide better healthcare for everyone.
So this is just a glimpse into the future of healthcare then, huh?
Absolutely.
Even though you said Amy won't be replacing doctors anytime soon, it feels like we're on the verge of something big here.
We are. We are. This is just the beginning.
So we've got Amy, this AI that's like having a superpowered medical student by your side,
Mm.
and it's already exceeding expectations. But what I find really interesting is how it changes the way human doctors work. You know,
Yeah.
it's not just about AI being right or wrong.
That's a key point.
Yeah.
When they looked at the feedback from those specialist cardiologists, the ones grading everyone's work, a really fascinating pattern emerged.
Okay, I'm curious, what were they saying?
So they noticed that AMA, being AI, approached the cases differently from the human cardiologists.
Makes sense.
AMI, true to its design, was praised for being so thorough, so sensitive to a wider range of possibilities.
That's safety net, right?
Yeah.
Catching those what ifs.
Exactly. The specialist pointed out that Amy was less likely to dismiss subtle clues or, rule out a diagnosis too early.
Right, like it doesn't have those ingrained biases, those assumptions that we pick up over time,
Yeah.
even with years of experience under our belts.
It's true. Now, the general cardiologists, they were often commended for being more concise and focused in their assessments.
Which makes sense, especially in medicine when time is critical.
Absolutely. You can't chase down every rabbit hole.
Exactly.
But here's the thing. That reliance on experience sometimes led them astray.
Interesting.
The specialists observed that this focused approach, it sometimes meant overlooking crucial details or maybe anchoring too firmly on that early diagnosis.
Missing those subtle hints that Amy caught.
Exactly. And that's why this whole idea of AI and human intelligence working together, it's so powerful. Each has unique strengths.
It's like two heads are better than one.
That's a great way to put it.
Or in this case, one human head and one AI brain.
I like that.
Working together, it's leveraging the best of both worlds.
Exactly. And think about the implications, not just for cardiology, but for all sorts of fields facing these kinds of challenges.
Yeah, if AI can help diagnose rare heart conditions, what about something like cancer detection, where early diagnosis is so important?
Or imagine its potential in remote areas.
Right, where they don't have as much access to specialists.
Exactly. AI could empower those general practitioners to make more informed decisions.
It's like democratizing medical expertise, giving everyone a fighting chance.
That's a powerful way to put it, and it's not just about access.
Yeah.
Think about the potential for making healthcare more efficient overall.
Okay, so how would that actually work? Paint me a picture.
Okay, imagine AI helping doctors sift through mountains of data,
Yeah.
maybe flagging potential issues they might have missed,
Okay.
even suggesting different treatment options based on the latest research.
So it's like having a team of invisible experts working behind the scenes.
That's it. And that frees up doctors to focus on what matters most, building those relationships with their patients.
It's not about replacing that human connection.
Right.
It's about making it even stronger.
Exactly.
Wow.
But we have to remember, this is still early days.
Right.
The Stanford study, it's a glimpse into what might be possible.
Right, we need more research to see how this plays out in different areas of medicine with all sorts of different patients.
Absolutely. But you can't help but be excited about the potential.
Yeah.
We might be on the edge of a whole new era in medicine, one where AI helps us understand things better and ultimately provide much better care.
It all comes back to those key findings about AME. It's thorough, it can detect those subtle clues, and it's really good at connecting those complex genetic pieces.
It's really remarkable.
But that raises another question. If it's this accurate, this helpful, where do we draw the line?
That's what we need to figure out. Where does AMI's role end, and where does the doctor's judgment come in?
Yeah, it's like, where does AMI's role end and the doctor's expertise begin? That's what I'm wondering.
It's a whole new world we're stepping into.
It really is. And if AI can already do this much, analyze data, help with diagnoses, could it maybe even help doctors recommend treatments?
It's definitely possible. Imagine AI helping doctors weigh different treatment options, considering everything about the patient, their medical history, maybe even their genes.
That's like having a personalized medical advisor just for you. But that makes me think, what about really sensitive decisions like end-of-life care? Could AI ever be a part of that?
That's a tough one, and we have to be so careful there. We're talking about situations where human compassion matters most, empathy,
It's more than just data at that point. It's about understanding what it means to be human.
Exactly, and that's why even as AI gets more advanced, We can't forget that technology should work with doctors, not replace them.
Finding that balance is going to be so important.
It is. AI can be a powerful tool, but doctors need to be able to connect with their patients, understand their worries, and help them through what can be a really tough time.
So as we learn more about AI and healthcare, it's not just about the tech itself, is it? It's about how we use it.
And having these conversations, figuring out the possibilities, and making sure that AI is used to help both patients and doctors.
It really makes you think, what would you even ask AMIE if you could? About your own health? Or just about the future of all this?
We'd love to hear your thoughts on this. Head over to our social media, share your questions, your experiences. Let's keep this conversation going because this affects all of us.
And don't forget to check out the full research paper. We'll link it in the show notes.
It's a really interesting read, gives you a lot to think about as we explore this new world of AI in medicine. Until next time, keep asking those questions and keep diving deep.